For this section of the Joints and Movement chapter, we're going to be looking at the terms we use to describe movement. Similar to the first chapter that uses special terminology to describe position and relative location of structures within the body, we also want to consider the special terminology we use to describe movements. We aren't going to just say that we bend the elbow. We need to use special terminology to explain which way the elbow is moving, which will set us up to understand which muscles are doing the various movements in the future. Like pairs of words to describe position in the body, anterior, posterior, superior, inferior, medial, lateral, those sorts of things. In movement, we're also going to see pairs of words. Not always, but they can often be implemented to be more specific about the type of movement that we're talking about. Instead of just bending the elbow, we flex the elbow and we extend the elbow. Flexion and extension is a pair of words that describe movement in two opposite directions. For the most part, from anatomical position, flexion is going to be a movement anteriorly in sort of a sagittal plane. So at the elbow, when you bend your elbow forward, that would be flexion anteriorly. At the shoulder, you can flex by reaching your arm out in front of you. Extension is going to be moving in the opposite direction. Older interpretations of these pairs of words mean that flexion is an anterior movement and extension is movement back to anatomical position. And a third term, hyperextension, is used to describe movement from anatomical position to a posterior position. Not all joints hyperextend. The elbow, for example, would flex and extend, but not hyperextend. The shoulder or hip would flex and extend and hyperextend. Or along the vertebral column, you would have flexion, extension, and hyperextension. The book currently in some sources will tend to use hyperextension to refer to abnormal movements that can result in injury. But there are some sources that will use hyperextension just to mean a movement beyond the anatomical position of a limb or the vertebral column. Also, the knee is an exception to this. The knee flexes posteriorly and extends anteriorly back to anatomical position. So it's a little unusual, but for the most part, flexion is an anterior movement, extension is a posterior movement, and hyperextension would be moving even further posteriorly. This figure shows flexion and extension relative to the neck. The same would be true for anywhere along the vertebral column. I want to point out something that I think highlights the necessary inclusion of hyperextension into talking about this pair of words. There are three arrows here, one demonstrating flexion, moving the head anteriorly, and then moving the head posteriorly back to anatomical position is labeled extension. And then another arrow shows the head moving posteriorly out of anatomical position, that's also labeled extension. It should be labeled hyperextension is the way that I'm describing it. This is another representation of flexion and extension. It says of the vertebral column, but with this type of drawing it's entirely possible that the flexion and extension could be taking place at the hip, with the upper body moving forward and the lower body remaining standstill. Notice again that there are three arrows, flexion, extension, extension. Again, I would call that third one moving from anatomical position posteriorly as hyperextension. The next pair of words to consider is abduction and adduction. To abduct is to move a body part away from the midline or away from the body. You can remember that as abduction, away from the body. And adduction is to move it back towards the body. This is represented in the picture here for the movement at the shoulder joint, but you could do the same thing at the hip. You can abduct and adduct the fingers. Also represented on this image is circumduction. That word literally means to draw a circle. Circum for circle, duct, carry, as in to carry in a circular direction. This is really a combination of flexion and extension with abduction and adduction. If you move your arm anteriorly and posteriorly while moving it laterally and medially, then you're going to draw a circle with the arm. You can circumduct with other joints as well, with the fingers, with the legs at the hip, with the head at the neck, those sorts of things. So it's a common movement. It's just represented here, moving at the shoulder joint. While circumduction is drawing a circle, another circular movement is rotation, which is pivoting at an axis, like with the pivot joint. The examples that we see here are at the neck, which would in fact be the axial atlantic joint, the joint between the first and second cervical bones. And then also they show at the leg medial and lateral rotation. Now when you're on midline, rotation can be in either direction and is just called rotation. But for joints that are off midline, when the structure of the body is moving towards the midline, that's medial rotation, and away from the midline is lateral rotation. The rest of the movement terms to discuss here are special situations. The ones that we already talked about, flexion, extension, abduction, adduction, circumduction, rotation, those are standard movements that are found in a lot of different places in the body. The rest of what we're going to talk about are special cases depending on where in the body we're looking at. The first one is the pair of words pronation and supination. This is describing movement of the forearm, which is usually seen as turning the hand back and forth, over and back and forth. The terms pronation and supination come from the terms prone and supine, which describe laying down. If you're laying down in an anatomical position, prone is laying on your stomach and your hands would be palm down. Supine is laying on your back and your palms would be up. So with your with your elbow flexed, your hand out in front of you, palm up is the supine position for the palm and prone is the palm down position. If you move the palm into its prone position, that's pronation, and if you flip it over with the palm up, that's supination. One way to remember this is to pronounce supination, supination. If you can hold a soup bowl in your hands, then your hands are supine. For the foot, there's a couple of important special situations. The first one has to do with flexion. If you're bending your ankle, you're flexing the foot in either direction. Plantar flexion is when you flex the bottom of your foot, which is what plantar is referring to. Dorsiflexion is flexing the top of your foot, the dorsal surface. Also for the foot, we use the pair of words inversion and eversion rather than abduction and adduction. Inversion is to roll your foot inward, which would have you standing on the outside edge of your foot. Eversion is to roll your foot outward or laterally, which would have you standing on the inside of your sole. These two pairs of words are usually used to refer to the jaw, although they can apply to other parts of the body as well. Retraction and protraction is to move anteriorly and posteriorly. When you protract your mandible, you're emphasizing an underbite. When you retract your mandible, you're emphasizing an overbite. The other pair of words is elevation and depression. When you elevate your mandible, you're closing your teeth together. When you depress your mandible, you're opening your mouth up. Elevation and depression, for example, can be used to describe the scapula as well. When you elevate your scapulae, you're shrugging, and depressing your scapulae is lowering your shoulders down. And finally, the last movement term is opposition. And this is a special movement of the thumb to touch the various other fingers on your hand. It's dependent on that saddle joint, which is unique at the base of the thumb, at the carpometacarpal joint that was discussed earlier. It gives us the ability to grasp things with our hands. Consider this question. When you feel that you've reached an answer, hit the next button to go into the next slide, which will reveal the correct answer. The knee is the joint that is opposite from the others. When you flex your knee, it's a posterior movement. As the old joke goes, imagine what your chair would look like if your knee bent the same way your elbow did.